yesterday, December 7th, 1941, a date which will live in infamy.
And so, my fellow Americans, ask not what your country can do for you, ask what you can do for your country.
Welcome. The show is in honor of, and as always, it's our pleasure to bring the show to you. A little note, as we're taping the show today, it's Flag Day. And as I was driving to come to the studio this morning, I noticed flags all over the place, on front steps, on porches, and what have you. And that's a very wonderful thing. What's not wonderful is come tomorrow, they'll all be gone. And I think let's show our faith in our servicemen. Let's show our faith in our country. Let's put our flag out every day, okay? Now with that, I want to thank Paul Dietrich, our co-host, who's always here with us. And we have a very special show today. And what I'd like to do is I'd like to introduce Mary McClune Lamanna. And she's been with us a number of times. Thank you for being here, Mary, and thank you for bringing the show to us. Tell us what we have here today.
Well, thank you so much, Ed. It's a privilege to be here, as usual, with you and Colonel Dietrich. Today is very special. Besides it being Flag Day, today is a day where we're informing everyone about the services that are available at the VA system. Now, as you may know, there are 2.02 million women veterans in the United States. There are 66,000 women veterans in New York State. Well, we need to be cared for. And where do we want to go? We want to go to the VA because we are veterans. We're entitled to the same benefits as all other veterans. And we're concerned that most people do not know about what is available in the VA. So to that end, we're very honored to have three representatives from the VA. We have Betsy Ruiz, Dr. Lois Katz, and Jennifer Friedberg, who work at the VA, and they will reintroduce themselves and talk about their positions and what their services are at the VA system. Thank you for joining us today.
Well, I'm delighted to be here. I am Dr. Lois Katz, and I've been at the VA for many years. All three of us are at the VA New York Harbor. I am the Associate Chief of Staff for Special Emphasis Programs, and part of my responsibility for that is the Women Veterans Programs at the VA and at all of our campuses. I am also an internist and a nephrologist, a specialist in kidney disease. I want everybody to know that we have a full range of services for our women veterans, and the VA does supply medical care to women veterans. We have primary care, and we also have special women's health clinics at both the Brooklyn and New York campuses, and we have practitioners who are experienced in women's health at our outpatient clinics on Staten Island, here on Staten Island, and also elsewhere in the network. And the other VA hospitals in our network also have services for women veterans. We do supply, both primary care and specialized care for women veterans, and the VA offers a full range of services. We have gynecologists at both campuses, a full-time gynecologist in Brooklyn, and almost full-time gynecologist in New York, in addition to a fee-basis gynecologist in New York, and someone who works at VA Central Office, a gynecologist who is head of reproductive health for the VA, who also does a clinic half day a week at New York, and also once a month in St. Albans. The VA does also offer mammography at the Brooklyn VA, and we offer other breast services at the Brooklyn VA. What the only thing the VA does not offer within the VA itself is maternity care. So women veterans who come to us who are pregnant, we refer out for maternity care. And there are some other specialized services, some of the GYN oncology, women who might have some sort of cancer, we would refer to outside GYN oncologists, because at the present time we don't have anybody at our facility who specializes in GYN oncology. But we do GYN surgery, and as I say, we offer a full range of services to our women veterans, including a full range of mental health services. So, and Betsy and Jennifer are our women veteran program managers, and I'll let them tell you more about what we have to offer.
I'm Jennifer Friedberg. I'm the Women Veteran Program Manager at the Manhattan campus. I'm also a psychologist by training, so I can tell you a little bit about some of the mental health services that are available to the women. Specifically, in Manhattan, we have dedicated groups for relaxation and yoga for women, where there won't be any men present. We also have women's clinic psychologists who specialize in working with women for assessments and one-on-one therapy. In Manhattan, we also have a physical therapist who specializes in pelvic floor therapy, who can help women who have some problems with that. In addition to my role as a Women Veteran Program Manager, I help with maternity care coordination. As Dr. Katz said, we don't have any obstetrical care in our facility, so we contract out to send patients to other facilities through the VA, and I help make sure that the patients who are going through that maintain their connection with the VA, let us know what's going on throughout their pregnancy, and I give them some counseling and follow up with them about various issues related to pregnancy throughout their pregnancy. They can also arrange to see a dietitian to get tips while they're pregnant about what they should be eating, a pharmacist if they have questions about what's safe for them while they're pregnant, etc. And Betsy is in Brooklyn.
So my name is Betsy Ruiz. I am the Women's Veteran Program Manager at the Brooklyn site. We wear many hats in this position. One of our roles is help coordinating care for women veterans, both new and old in the system, in our C-Box and in our main facilities. One of my main roles is assisting with breast care. As Jennifer assists with maternity, I assist with patients in need of mammography, biopsies, and coordinating their care. Also, another big role that we have is, one of our main roles, both of us, is just ensuring that along with the EOC rounds, environmental care, ensuring that our women have privacy and throughout the facility, and no matter where they go, they're treated with respect and dignity, because that's one of our main goals when they come to any of our VA facilities.
Now, I'm a woman veteran, and I want to get care in the VA. I mean, what do I do? Who do I call? How do I go about entering the whole system? Because there are many veterans out there who have no idea. Some of them actually are a little frightened to go to the VA because they don't know what to expect. How do we kind of make it seamless and non-threatening so that we can, in fact, have more women veterans utilize the VA system?
Well, they can go to our website, and we do have an extensive website which has lots of information about our women veterans programs, about primary care, about all the other programs we offer. In addition, there's extensive rehabilitation services available at the VA for both men and women, but we do have people who are specialized in working with women. There on the website, there is a phone number for centralized scheduling, and that's one of the places that you can call and explain that you're a new veteran, and they will give you, and you ask for what you want, and they will give you an appointment and explain that, to come in and be sure that you show that you are a veteran. Right. You need to bring some paperwork with you, but. Right. Or people can just come directly to the hospital or at either campus or also at St. Albans, or one of our outpatient clinics. And at that time, they can, ask to be seen. And we do have walk-in clinics and emergency rooms at both the New York and Brooklyn campuses. And there is a clinic, an outpatient clinic at St. Albans, so people can walk in there too. But you can call the hospital and either call the main number and ask for the scheduling folks, or there is an 800 number for scheduling.
And Betsy and I can also help if people are overwhelmed by dealing with some of this and they're new. Betsy and I in Brooklyn and Manhattan can take people over to eligibility. We can give them a tour of the dedicated women's areas in Brooklyn and Manhattan. We can help people get connected to the designated women's health primary care providers, which are in Brooklyn, St. Albans, and Manhattan, as well as the Staten Island and Harlem CBOCs. It's primary care providers who have special training in women's health issues and can kind of treat a woman comprehensively and even offer PAPs at their primary care appointments rather than having to go for a separate gynecological appointment. So they can contact us to help walk through that as well.
Would you be willing to give your contact phone numbers out to the audience? Because I've noticed some reluctance not only in men veterans to going to or contacting the VA, but specifically women veterans tend to be reluctant for whatever reasons. But a phone number, a lot of times in talking to somebody, reassures them, and the answer is we want people to come in.
Right.
If you're a veteran, we want you to get the services that you earned, and you earned it. So if you would be willing to give your phone numbers, I think this would be an appropriate time and whom to talk to.
My number in Manhattan is 212-951-3314. And we can direct you to the appropriate person
Yes,
if we can't help.
Now, one of the topics that you see more and more in the news today is the military sexual trauma. If I needed some intervention, but again, didn't know where, who, what, where, like you said earlier, Betsy, privacy is such an important thing. Maybe I only want to speak with a female. I don't want to speak with a male. I don't want to be in a room with men. How can the VA accommodate me so that I can, in fact, go for help and feel secure that I'm really going to be helped?
Want to speak to them?
Sure. Well, each facility, including Brooklyn and Manhattan, has a dedicated military sexual trauma or MST coordinator who can help navigate some of those issues and make referrals in terms of getting therapy. There's an MST group in Brooklyn, and then there's one-on-one therapy available at all the different campuses, as well as the vet centers for anybody who has MST. And in addition, all of our women's health providers are particularly sensitive to the MST issues, so we would recommend that women who have MST request to be seen by one of the designated women's health providers at one of the campuses so that they can kind of get comprehensive care with somebody who's familiar with these issues. Certainly all of our staff in the VA are aware of it, but the women's health providers are particularly sensitive to it.
Is there any one particular number that the individual should call, be it man or woman, to get, not get the runaround, to be blunt, and to kind of get where you want to get in a timely fashion? Like if I call the operator at the VA, if I say I want to speak to someone relevant to MST, will they direct me directly to you, or how would I go about it?
I would say you would ask for the MST coordinator. MST coordinator in Manhattan is Sheila Keyser, who's a certified nurse specialist, and the MST coordinator in Brooklyn is a psychologist, Shalini Segal, so they can ask to speak with one of those people, and Betsy and I can certainly help with women who have these issues to connect them to the right people as well. Unfortunately, I don't know their exact phone numbers offhand.
Okay, no, that's fine, because like I say, that's been a topic that's been talked about many times, and where we want to make sure that everyone out there knows what's available. Not only the woman veteran, but the male veterans too, because maybe their spouses, girlfriends, mothers, whatever, sisters, may also want to seek VA care, but they just really don't know what to do. Now, Do they have any particular units specific for women? So when I
Yes.
go in there, and if I have a child with me, that, let's face it, many times it's difficult to get a babysitter, so you bring your child with you. And what available areas do you
We
have
have
there?
women's health, special women's health clinics
Oh,
at
okay.
both the New York and Brooklyn campuses. And with waiting rooms for the women now, if they bring, a spouse or somebody else with them, there may be men in the waiting room, but for the most part, those waiting rooms are, the women are there. And so we have clinic rooms and all the facilities necessary for the women. In Brooklyn, that also includes mammography. In New York, it's just the clinic rooms where we have women's health clinic and we have the gynecology clinic. And when the psychologist is there, she's also in that clinic. So we have all the services available to the women if they come to the women's clinic. Now, many of our women also go to general primary care. And, they can see women. We have lots of women physicians at the VA, so that any woman who feels uncomfortable and wants specifically to see a woman physician can do so. We also have women gynecologists, so those options are there for people.
Very good. Very
And
good.
the New York Women's Health area is an area that was recently renovated, and we are starting construction in our own area in Brooklyn. So it's going to be really, really beautiful with an area specific for child care, and hoping that all the women that go there feel very comfortable.
And the access, it's easy to, once you hit the front doors. I know some women felt funny that they were being looked at, and I said, listen, I don't think there's any problem getting to either one of the women units for any of the campuses, and if you need some guidance, the staff will be happy to help you.
Absolutely. And I also want to mention, I know you had said that it can be an issue for child care. We also offer extended hours for people whose schedules might not permit them to come during the day. So we have some Saturday hours for some of our women's health providers and evening hours a couple times a month.
Are there any services or things that are coming to light now in the system that you'd like to share with the audience to let everyone know how progressive the VA is? Because unfortunately, we don't hear enough about the positive qualities of the VA. And again, the purpose of our show today, one of the purposes is to let everyone know out there what is available so you can avail yourselves to all the services.
Well, for example, we have a new radiologist who is a specialist in women, radiology procedures for women, and we will now be doing breast MRIs at the New York campus. She has just been setting up that process, but that will be happening. She also can do stereotactic biopsies, breast biopsies, so that's something else that isn't offered everywhere. I also should mention that we are a tertiary care facility, the Harbor, and we do a lot of cardiovascular surgery and interventional cardiology procedures, and so we really offer a wide range of services. I believe we will be doing robotic surgery soon. We do a lot of minimally invasive surgery in all areas. And our gynecologists do, can do rather complicated surgery also. So we really do offer. We also have neurosurgery at the New York campus, and we do get referrals from around the network for those services, and also for the cardiology and cardiovascular services.
And
So
it's-
what you're saying is that the VA does offer state-of-the-art.
Absolutely.
Yes, state-of-the-art, contrary to what the media portrays.
Right.
And I think that's important that the viewing public know this. I think it's important that the female veterans know this and that they utilize it. And if they're reluctant to get involved, this is why we're bringing this program to you, so you could get a handle on what you have to do.
Right.
Yes, and we also offer very high-quality preventive care. And when you compare the VA to other HMOs or other healthcare organizations, we actually do better on most of the preventive health measures than other organizations in the country.
Is there anything specific for a female with PTSD? Because I've heard some reluctance from some of the female veterans to talk about their experiences, particularly if they've suffered PTSD. So is there anything specific in that area?
I'm not sure we have any special groups, but we do certainly offer one-on-one counseling.
Okay.
And we do have some groups that are mostly women or all women,
Okay.
because we do understand that, particularly in that situation, the women may not be comfortable.
Different experience.
Right.
Yes.
And many of our mental health providers are women, so that
Okay.
a lot of our female patients feel more comfortable describing their
Yes.
experiences to women.
I think some of the confusion regarding the campuses in the VA system is like, why do I have to go to the Manhattan campus versus the Brooklyn one? Well, because the service, the available services, like you said before, from my experience in visiting the campuses, cardiology and neuro are primarily in the New York campus.
Right.
And some of our brother and sister veterans, they may be, inpatient in the Brooklyn VA, and then all of a sudden they're being transferred to Manhattan, and they have a difficult time understanding why. And as I explained to many veterans over the years, even in the military, the hospitals, even in Vietnam, one was a chest hospital, we were dialysis, another one was neuro. I mean, that's just the way it is.
Right.
You have your specialty areas, and the truth of the matter is, you want to get the veteran to the area that is best equipped and the staff is best prepared to care for this veteran with this specific problem. So it's not that they want to give anyone a runaround. They just want to make sure that that veteran gets to the area that can best suit their needs, which I think finally they're realizing that. Now, St. Albans is that have a nursing home type facility?
It's a community living center, yes,
Okay.
which
Alrighty.
used to be called a nursing home. But they do offer rehab there. They also have hospice care at St. Albans, so that's another option for some of our patients. They do have the outpatient clinics there. They have a number of specialties there, including ophthalmology and other specialties at St. Albans. They don't have everything. We do have a women's health provider there. And we also are now sending a woman gynecologist is there one session a month.
Very good, very good. And Betsy, you're primarily based at the Brooklyn campus?
Yes.
And Jennifer, you're primarily based in the Manhattan campus?
Yes.
And Dr. Katz, you're
I'm primarily in New York,
in New York, okay.
but responsible for the programs everywhere.
Right, yeah, that's the one thing we learned in our visitations, that when we spoke with one of the managers, they in fact did have responsibility for both campuses. So when we were talking about leadership, we'd see the same people,
Right.
even though we were visiting different campuses. Well, is there anything else you'd like to share with us? Anything new on the horizon at the VA?
Well, in Manhattan, we had several investigators who had a grant last year for preventive health topics for women who had sexual trauma histories, and it was a successful program. So we recently got another grant from the Office of Reproductive Health in Central Office from the VA to open it up to all women veterans. So we've been having monthly classes on a variety of topics. And coming up on June 27th, we have one of our psychologists giving a talk on healthy relationships. Then in July 14th, I believe, we'll have one of our women's health primary care providers giving a talk on setting manageable weight loss and exercise goals, and we hope to continue that through the rest of the year.
Beautiful, beautiful. Like, as you can see, that there are many services available for all women veterans. All you have to do is pick up the phone, reach out, and the The concern and care is there, and I can tell you, having visited several of the facilities, the one thing I came away with was that the staff truly cares about what happens to the veterans. I know sometimes you hear negative things about it, and some of the veterans just don't want to hear anything about the VA system, but as a user of the VA system, I can say very honestly, regardless of what doctor I see, I've never had a problem. I found the staff to be very friendly, very receptive, and it's something that, please, if you need any type of assistance, reach out to the VA system. If you have any questions, I'll be happy to give my number out. It's 718-698-1976, and I'd be happy to direct you to anyone in the VA system. And if I don't have the answer, I surely can reach out to someone who does have the answers. But the most important thing is for you all to make the phone call, and we want to care for you. That's what we're there for. And as the director once told me, there's no greater honor than to care for a veteran. And on a personal note, as a nurse of many years, I have to say I agree with that 100%. Any closing remarks? Doctors, ladies? Well,
Well, Dr. Jennifer, Betsy, I'd like to thank you for being here on the show. Mary, I'd like to thank you for bringing this program to us. I'd also like to invite you to return, and let's do a regular program where maybe you can just update people as to what to do, and help them get off the dime and do what they have to do for themselves. But I can't thank you enough for being here today. It was most informative. There's a lot to learn, and the female veteran out there has got to know that there are people who care.
yes.
And the people come in the form of the VA. They also come in the form of the organizations, the American Legion, VFW, have changed their way of doing business, where they address the problems and the needs of each individual, whether you be male or female, and they treat the individual as an individual.
Right.
And the biggest thing I got to say is, the VA, I have not heard a negative complaint about the VA from any of the people that are using the program. I read about it in the papers, but I don't believe it. So, and with
Again,
that, I'd like to say
you've got to
thank you.
reach out. You veterans out there have to reach out to the VA to get your care that you earned. You earned it.
Well, with that, I'd like to thank everyone for being here. I'd like to thank everyone for watching. We love bringing in honor of to you on a regular basis. We will continue to do so, and hopefully we're going to have a lot more input with programming from the VA. Once again, Betsy, Jennifer, Doctor, thank you so much. Mary, thank you. Paul, thank you. We love you. You just keep watching.
Thank you.
You're welcome.
Thank you, ladies.